It appeared so complex that I felt exactly like what intellectually challenged must be feeling while going to school. Right? So I have to see role of law in healthcare. Two things. I will probably speak in monosyllabic terms for want of time. So one is law on paper and law in practice. There is a huge gap, at least in my country, between law on paper and law in practice. I do remember many years ago, 25 years ago, the first woman justice of America came and we had a kind of a roundtable discussion with her about laws pertaining to women and everything. And unfortunately, I had to say the same lines that time. That first of all, do women know that there are laws like this? And if they know how they can take assistance of it, can they afford it, first of all? Both in terms of time, knowledge, and practice. So that is a very important issue for me. Second is, we are talking of rights. When we talk of law, we talk of rights. When we talk of healthcare, we talk of responsibilities. I think rights and responsibilities are two legs for a very stable stand. And suddenly there has been a shift only about the rights. And this shift has come, I think, from a very self-centric thinking, which is the maybe boon, I don't know, of the current times. Especially when the education was left only to reading and writing, which was in the cognitive domain. See, the digital media followed print media by 350 years. So rather, print media preceded digital media by 350 years. So suddenly there was a paradigm shift in the concept of education and literacy to reading and writing. And reading and writing became such a hallmark of literacy and education that all of us had to study reading and writing of 3 languages of words. And this is entirely in the domain of cognitive brain. So what happened is, now over the years, we have become a society with swollen cognition and shrunken senses. Because from the moment we start going to school, there's no focus on learning from other tools. That is seeing, listening, touching, which was part of medical training also. The entire clinical skill was based on sensory perceptions, from inspection, palpation, percussion, auscultation. And that's precisely what is missing. Now, when digital media came, I suddenly found that there is at least a way to harmonize. What is harmonizing? Because when understanding ends, law begins. I repeat, this is very important. If we have to run a house and live jointly and happily, we don't float tenders in the morning to see what sabji is to be bought, and out of 3 we choose. No? We live on understanding. Right? And the moment we go to this law segment, at the sheer necessity of, or the evidence that the law is growing, means understanding is going down. Compassion is going down. Thinking about somebody else is going down. And there's a wonderful book by Sudhir Kakkad about psychosocial study of Indian childhood, where he discusses the ego development, Western ego development and Eastern ego development, achievement, motivation, vis-a-vis concept of sacrifice, I think. So the compassion has become one of the reasons why I'm almost in the process of changing profession from doctor to smuggler. I realize that if I have to resort to true education, I must try to develop sensitivity in people, because cognition is being taken care of by the formal studies. And there is no better medium than film medium for developing sensitivity, because it combines all three: image, sound, and words together. So what you might have seen there is the domestic situation. It's not resorting to law. There are laws about elder care. The tragic situation is, in spite of the fact that the person, the heads of the family, wanting to take care of their children and their elders, we change to such a lifestyle that they have no time nor the resources to do that. And when the traditional families are breaking down, we are gradually developing new social families, which are called self-help groups. So I resorted to this, and I think we must find a meeting point between law and medicine, health care. As I said, health care refers to something else than law. Law should be like a guide. घोड्याला झापड कशी लावलेली असतात, so that you walk in the direction you want, you don't go here or there. That's what the purpose of law. Law should be like a reference book, but it can't be textbook for life, I think. And that's where I think the things are going wrong. Since before they show me another plate, I think I will show you another clip from my recent film, which got Golden Lotus. And this is pertaining to the major social issue, not only health issue, is depression. Depression amongst youth. 800,000 suicides every year around the world. Highest percentage is in India and Southeast Asia, between age group 15 and 19. So how to deal with this situation? Can we deal with it with law? I don't think so. We can't. With understanding and consideration of other, instead of thinking of self, putting you as the center of the universe and drawing the world around, try to be part of the universe, and that helping. So unless there is internal cultural growth, I don't think these external means would help. And that's what we try to bring in the medium in which we can, followed by discussion. So I urge everyone that let's consider significant rights and responsibilities together. One can't be considered in isolation of the other. It has to be considered together. If not, what happens in practice? Law gets more and more complicated. And in the process, persons abiding law are victimized. This is said in my play. So instead of implementing the law, you try to complicate the law so as to include everybody else. Only law gets complicated, nothing else. I think simplification of law, the day when law will be simplified, I can assure we have become a healthier society. So, can we have the clip from Casa? या पृथ्वी तलावरचे सुरुवातीचे काही जिवंत पहिले प्राणी आहेत ना, त्यातली स्पीसीज आहे, म्हणजे डायनासोरची आधीची.
त्याला विचार तरी कोण आहे, काय आहे?
त्याला सांगायचं नसेल तर उगीच कशाला डिवचायचं? माणसा, कसा आहेस?
मॅम, माणसं अशी का असतात?
कशी?
दुष्ट आणि दुःखी.
माझं दुःख तुम्हाला नाही रे कळलं.
जडजडून काम करायचं, भरभरून कष्टाचं खायचं, जीवाला जीव लावायचा. कशाला वाटतं एकटं?
मोबाईल हातात घेतला की व्हॉट्सॲप, फेसबुक नाचायला लागतं डोळ्यात. लाईक, डिसलाईक.
मी तुका सांगतो, एका वेळी एकच करूचा. भजी खाऊची तर भजी खाऊची, चाय पिऊची तर चाय पिऊची, आणि दोन्ही एकदम कोंबलं तर ठसकू लागतलो.
हे ओढुने सर्वत्र विषय आतुनी इंद्रिये, जसा कासवतो अंगे तेव्हा प्रज्ञा स्थिरावली.
कहाँ से तू आई रे, चिनक भरमाई रे, लहर समंदर रे, तू लहर समंदर रे.
Thank you very much. I think the crux lies, if we have to learn and to be educated, we need two things, interest and intellect. This medium can get you interested in the subject. And if you get interested in the subject, you start thinking about the subject. Law deals again in the area of cognition, healthcare in the area of affection. So the harmony of emotion and intellect is absolutely essential to marry law with the healthcare. Thank you.
Thank you, sir. And we do assure you that with your wisdom shared, law will be more compassionate, and it's already evident in the mental health care law. I now request Professor Chris Gledhill from the Auckland University of Technology Law School to give his deliberation on mental health and global advocacy perspectives.
Thank you very much for the chance to address you. I want to talk to you, if I can, about the importance of the human rights framework, because sometimes there are laws which are simple, and sometimes there are laws which set out important policies and can also set out important responsibilities. So if I could have slide one, the next slide, please. What I want to talk about is the message that is sent out by the International Human Rights Framework. And it starts with the Universal Declaration of Human Rights of 1948. But importantly, it emerges from the horrors that went before, not just the immediate horrors of the Second World War, but the preceding centuries of horrors of colonialism and slavery, and views based on eugenics, the ideas that some people were worth more than other people. And because that was such a horrendous message with such horrendous consequences, it was important to have effectively a worldwide constitutional rebirth, starting from the principle that people, all people, are equal in dignity and rights. And that's the first importance of the International Human Rights Framework, and of course it chimes with the history of India and the formulation of a constitution that reflects the rebirth of the nation. There is a second reason why the International Human Rights Framework is important, which is that it is accepted to be a living document or a living series of documents. And as a result of that, it is a body of laws, of policies, of practices, which can be used by those who want to be active in seeking better solutions for people who deserve better outcomes in terms of their rights. In other words, it is a model framework which allows activism, including by judges. And again, there is an obvious chime with the Indian experience of the activism of the Indian Supreme Court when moved by lawyers who are interested in progressing social justice messages through law. So these two features of the international human rights framework combine to allow advocacy towards securing, in a better way, dignity for all people. And it does this by a series of key techniques. One is the negotiation of supplemental treaties as part of the human rights framework. As I mentioned, it starts with the Universal Declaration of Human Rights, but there are other covenants signed in 1966, and then they have developed, in particular, in the current context of mental disorder, with the Convention on the Rights of Persons with Disabilities of 2006. The importance of that particular treaty, I should emphasize, is that it wasn't just handed down from the delegates of the United Nations. Rather, it was negotiated by groups of people, including representative organizations of people with disabilities. And therefore, it was done in a collaborative fashion, ensuring that appropriate standards were put in place. So one key technique for international human rights law is the negotiation of additional formal treaties. A second aspect is expanding the understanding of what rights mean, because it's a living instrument, by processes of discussion, negotiation, and so on. So the work of the treaty monitoring bodies of the United Nations and of the special procedures mechanisms of the UN are instances of this. The third method that can be used is strategic litigation. And I'm a lawyer. I like litigation. I used to make money out of making litigation. That may be one reason why I like it. But I'm going to focus on that. There is, in effect, an international form of public interest litigation whereby rights can be expanded and developed for the benefit of vulnerable people, including vulnerable people with mental disorder. So I want to focus on a selection of the techniques or the outcomes that have been achieved by this third technique of strategic litigation. So if one looks at the main rights that can be used, one thing that has developed, using in particular the rights to life, not to be tortured, and the liberty rights, are the concept of the duty to protect rights. So if I could move on to slide number 7, please. If you go back one, please. Go one more. Thank you there. The duty to protect is the obligation of the state to provide, first of all, a legal framework which allows rights to be respected. So in relation to the right to life, there have to be laws that protect life, including, for example, mentioned there and arising through the case of Dodov against Bulgaria, the regulation of dangerous professions. And frankly, the medical profession is a dangerous profession because lots of people die as a result of the activities or non-activities of doctors and nurses and those in caring environments. So what this case law demonstrates is that there is a state duty to regulate to ensure safety. There is also a duty to protect individuals who may self-harm. So if one can move on to the next slide, please. There are duties not just to have laws, but to enforce and implement policies to protect people. So next slide gives you an example of this in a self-harm setting. There are also duties in relation to harm from others, including those rare instances when somebody with a mental disorder may pose a risk to others. The same standards apply in relation to matters such as protecting people from inhuman and degrading treatment, and slides 15 and 16 illustrate instances of those. So, number one, there has been a duty to protect developed as part of international human rights law. Secondly, there have been the development of due process standards. So if one could move, please, to slides 20 and 21. Next one, please. And the one after that. And keep going. Sorry. There we go with that one. A whole host of cases here, and you can look them up when the slides are made available. But the essence of these cases is a group of lawyers in Eastern Europe got together and decided that they would make a significant change to the lives of vulnerable people in institutions in Eastern Europe by taking strategic litigation to compel governments to live up to their obligations. And these are cases which have clearly had a significant impact. The final aspect I want to mention, and if one could move on 4 slides, please, is the new development, sometimes called the new paradigm, of the Convention on the Rights of Persons with Disabilities. And in particular, Article 12 of this convention makes the point that all persons have the same legal rights because they all have the same capacity to hold rights. But when it comes to exercising those rights, there may be differential capacities based on mental disorder. And what we have to do to avoid the paternalism of the past and to recognize the inherent dignity of people is to ensure that there is supported decision-making in contexts such as these. And this is an important message that demonstrates the vibrancy of the international human rights framework, and it's one that I hope you will all bear in mind when you are advocating for better outcomes for the dignity of vulnerable people. Thank you very much.
Thank you, Professor Chris Gledhill. I'm very happy to note here that most of these principles have been accommodated in the recent Mental Health Act. Now, before we move on to the next theme, we had a snippet of a quiz. Unfortunately, there's a pressure on time, so I would suggest that we manage the quiz after the next segment of our discussion. The next segment of our discussion is Global and Comparative Healthcare Law. I request Dr. Santosh Kakade to give his exposition on comparative healthcare law.
Good afternoon to you all, dignitaries on the dais and dignitaries in the audience, and my friends. I would be quickly taking a review of the global healthcare law. And the healthcare law, it has been defined as, next please, the law that deals with legal issues regarding the delivery of healthcare services. Another term which has been coined is legal medicine, and it is the field of study and accumulation of materials which deal with the application of medical knowledge to the administration of the justice. In a very brief manner, I'm going to take a review of only 3 systems, that is the healthcare systems of US, healthcare system of UK, and the healthcare system in India. Next, please. Yeah. Now, as we all aware that the healthcare system in India consists of different kind of systems which we inherit from UK. It is said that the United States, the healthcare law as such, or the legal medicine as such, is well advanced. The concepts which have developed are the patient safety, the patient information is available to all the patients, the concept called information disclosure, that means if the errors happen, they are disclosed to the patient's relatives and the patients. Most important concept is error monitoring system. This is good. I think this is going to be discussed by Dr. Nikhil also, which usually is present in the Western countries. Monitoring and preventing of errors is very important in case of a patient safety. And connecting compensation, which is being awarded to the error prevention systems. Meaning is that whenever there is an error, medical error, the compensation which is being awarded for the medical negligence being proved because of the medical error, that is deterrent to the next kind of a thing, and the system improves on itself. Next one. What is the status in India? India, we have a piecemeal approach. The law governing medical negligence is the one which is of a primary importance, and it is in the evolving stage. Starting from the law of torts, this concept is being controlled or governed by nowadays the Consumer Protection Act. And Consumer Protection Act, which was applied in 1995 to the medical field, it has come out with various principles, legal principles. These legal principles, they are currently governing the law of medical negligence, but then to the effect of which, rather than having preventing systems, the system which is there is that has promoted enmity between the medical professionals and the patients. Next one. We talked about the Consumer Protection Act. Now, Clinical Establishment Act is one more attempt to control the medical practice and the clinical establishments. New National Health Policy has been announced, and the efforts are there to distribute freely medicines, laboratory services, and the availability of the services, emergency services. While talking about the comparison between the 3 systems, that is US, UK, and India. In US, the systems of medical error, there is a system which exists which is voluntarily disclosing of medical errors, and these errors are monitored. Similarly, UK has the healthcare system which is given by NHS, that is National Health Service. It has a specific body which is known as NHS-LA, that is National Health Service Legal Authority. So this is the body which monitors the medical errors or the law which governs the medical negligence there. In India, this approach is not there, and monitoring, recording and monitoring of medical errors is very much important so that the further complications that happen with the patients can be avoided. So, the systems which are present in US and UK, they are more advanced, more comprehensive, which are leading to the globalization of the health law. Next one. I'm addressing only one parameter, which is medical errors. That is also very much superficially. There are so many other parameters which are there which can be talked about. We need to have a focus on patient safety. We should have error reporting systems and information disclosure, so that the information disclosure should be such that after the information disclosure of the medical error, it should not catch the civil liability. One more aspect is medical expert system, which helps the litigation. In Western countries, there are registered medical experts which help the system. But in India, we don't have that system. It is the government doctors who are considered as the experts all over, and we need to have medical expert system, which should be well defined. So, one more suggestion can be, we need to have the state health tribunals, that means separate health tribunals or health courts. The reason being, whenever any issue is discussed or any case of medical negligence is being pending in the litigation in the consumer courts, usually the domain knowledge is absent. The judges, the advocates, they don't have the medical knowledge, and hence there is a problem of delivering justice. So this is a quite big gap, and this gap needs to be addressed by separately constituting the health tribunals, which should consist of the individuals or the experts who have domain knowledge in both the fields, medical as well as legal. Next one. So there needs an integration. The healthcare system needs to be patient-centric. As we are talking about the healthcare system, the system which also takes care of injury to the patient because of the delivery of the healthcare, that also needs to be patient-centric. The overall aim should be healthcare justice. Unfortunately, whenever patient approaches a system, healthcare system, which with the expectation of treatment, that system itself unintentionally harms the patient. And this is the thing which can be prevented by having a comprehensive system. As there should be universally accessible healthcare as well as affordable healthcare, the medico-legal help and the litigation help should be also universally accessible and affordable. Next one. So what is the way forward? The way forward can be, it can be looked as presence of alternate dispute resolution systems instead of the current systems of litigations, which will definitely help in sorting out the problems then and there itself. There are few dimensions of latest dimensions which are talking about law affecting surrogacy, laws which are affecting the assisted reproductive technology, laws governing the telemedicine, and laws which govern the medical tourism. Unfortunately, there are no clear-cut defined laws, so this also adds to the gaps, and these gaps need to be tackled by definitive laws which should take care of the patient's rights as such. Next one. So, with this, I have just tried to address only one dimension, that is system of medical errors. That is very important, and this must be taken care by having a very good system of reporting of the medical errors plus monitoring, and then probably a new concept called no fault liability also, which exists in the New Zealand, that also can be introduced in our healthcare system. So with this, I thank the organizers, especially Dr. Gurpur madam and Dr. Rajiv Irodekar sir, for giving me this opportunity. Thank you very much.
Thank you, Dr. Kakre. Now we will have a speaker who is going to unveil the legal dimensions from the global angle, from the Middle Eastern and African experience. I request Solicitor Sunita Singh Dalal to take over the podium.
Is there a clicker? Can you just show me quickly? Sorry, while we're waiting, first of all, it's a privilege to be here, obviously. I deliver talks in a slightly different way, and today to be here in an educational institution, the way I would like to talk to all of you is to inspire you and give you a different perspective, especially to the next generation, and those of you that are lucky enough to study here in this institute, and to give you something to think about as to future career options, possibilities, and the world of globalization from a healthcare perspective.
This one for the next, this one for the back.
Thank you. Right, it's a bit of a whistle-stop tour because of timing. What I'd like to start with, obviously, is Africa. Africa is 54 countries. Can everyone hear? Right, when we first talk about Africa, I think immediately and historically people think about South Africa, one of the more developed gateways into the continent. I'm about to show a couple of rather controversial and maybe amusing slides, but it's an actual depiction of reality on the ground in South Africa. First of all, the CIA do a 15-year prediction in relation to strategy on developing countries and nations. Interestingly enough, they predicted, of course, depopulation purely due to HIV and AIDS. So we're looking at communicable diseases. And this is something that people have concentrated on a great deal. And all the while, they've forgotten about the double disease burden that is actually creeping upon us very silently. And I'll elaborate on that in a minute. This is what healthcare in South Africa looks like, or rather looked like, 5 years ago. This is an actual slide that a colleague of mine from the Harvard Business School clicked, and she consults on healthcare projects in Africa. So this is our wonderful Dr. Juma, and as you can understand, he's very talented. I mean, he can deal with vomiting, diarrhea, insanity. He goes all the way up to casino and bad luck and court cases. Now, bear with me for a minute, because this is what globalization is about. So we have this paradox of Dr. Juma being a healthcare specialist, but he's got a website, and his website offers even more. And as I emphasize, this is reality on the ground. So let's talk very quickly about how we change that reality and how most of you here, with the benefit of hindsight, can apply yourselves and your education to underdeveloped countries and talk about delivering a globally enriched healthcare system. So the dynamics of sustainable growth across the Middle East and Africa, the facts speak for themselves. Healthcare system infrastructures need to be strengthened. We have to build capacities. Demanding consumer and the range of treatments that are being administered are also very consumer-driven. The double disease burden is something that is very interesting, because as I said earlier on, whilst most people were concentrating on communicable diseases, what we've forgotten is that disease itself is evolving along with the evolution of industry and society. So we look now at what has become the latest epidemic that we all need to deal with and concentrate on, which is actually chronic non-communicable disease. And by that I mean, for example, cardiovascular, lifestyle, metabolic, cancer, respiratory, diabetes, etc. There's a very quick slide there that shows that there is a direct correlation between wealth, urbanization, development in societies, and chronic disease. It's very interesting to see how we have the challenge on our hands that we need to deal with, and the challenge is here and now. So if you look at the UAE,